Welcome, everybody. We're just waiting for folks to continue joining. Happy to see you here.
Oh my God, you somebody here?
Once again, welcoming folks to
Here in
our huddle
Mississippi
call.
or where you are?
In Mississippi.
Give us another moment before we
I haven't been. I've
get
been so
started.
busy with being at Roro that I haven't seen anything. He had bronchitis this week, and I had to give him breathing treatment. And I was off yesterday for cleaning.
I know how they go.
But I was also off. Nobody knew I was off Tuesday. My staff don't even know I was off Tuesday. And if they did, they.
Okay, so we're now at 12:30. I want to give another minute for people who are joining from the waiting room to pop on. And then we will get started. So I want to welcome everybody to the second of our series in the Huddle calls for ensuring access to the COVID-19 vaccine for homebound older adults. My name is Margie Beaudry. On behalf of Trust for America's Health, I'm very pleased to welcome you to this call, and it is to discuss challenges and solutions for ensuring access to the COVID-19 vaccine for homebound older adults and people with disabilities. This session is being recorded so that we can capture all ideas and experiences shared. This call series is part of an initiative to identify and foster adoption of innovative and promising practices on this topic. This work is made possible through the generous support of the John A. Hartford Foundation, which works tirelessly to improve care for older adults, and the Cambia Health Foundation, which is dedicated to improving the way people experience healthcare. Access to the COVID-19 vaccine for older adults is being prioritized across the country due to the vulnerability to more serious illness from the virus among this population. However, for the 2 to 4 million homebound older adults and individuals with disabilities, access is challenging or impossible. These challenges are not well understood, and there is no clear sense as to which government agencies should take the lead. There are challenges in identifying who is homebound. The state and local governments have no clear path to ensure that they will be able to find them all, nor how to address the complexities of increasing the numbers of certified vaccinators and stabilizing the supply of vaccine for multiple home visits that are geographically dispersed. Vaccinating homebound adults is made even more challenging because of the crazy quilt of definitions, vaccination policies, reimbursement difficulties, and workforce needs, not to mention cultural and language barriers that must be overcome to vaccinate this population. But state and local health departments across the country, working in partnership with aging networks, hospital systems, and other community partners, are turning their attention to this population, and a variety of innovative practical solutions are emerging. In studying this topic, we are seeing some themes emerge. Over the course of this call series, we expect to touch on each of these themes from various perspectives. We are all learning together at this critical moment in time. These huddle calls are designed to share just in time or just learned information as broadly as possible. I will ask that those of you who are attending, please mute yourselves so that we will be able to hear our speaker. Today's discussion is focused on the value of collaboration and partnerships. I'm very pleased to welcome Brett Fiorine from the American Academy of Home Care Medicine. He will share his perspective on this topic, after which we will open it up for discussion about your experiences and how this plays out across the country. Brett, the stage is yours. And what we can do is, yeah, go ahead. Thank you.
Thank you, Margie. Very nice introduction. It really tees up the topic well for today. As indicated, I'm Brent Furine. I'm the Executive Director for the American Academy of Home Care Medicine. And I want to thank the Trust for America's Health, Johnny Hartford, and Cambia for really taking interest in this very important topic. It's a topic that our Academy is focused on and working hard to do what we can do to improve access. So we're a 1,000-member organization, and we represent those that practice medicine in the person's place of residence. So that could be a home or assisted living. We're about half physicians. The other 25% would be advanced practice providers like NPs and PAs. And then the other quarter, remaining quarter, would be those on the care team, such as social workers, RNs, and business managers. This has been a challenge for our membership, and so we've convened a vaccine clinical advisory committee. And in addition to sourcing government information from the CDC and others, they've also surveyed practices and programs on what folks are doing nationwide. And from that, we've produced a couple of educational webinars, as well as a COVID vaccine page on our website with an FAQ and other information and resources that we think are valuable to those that are working with the home limited population. So I'm going to talk a bit about how partnerships and collaborations are key to this success. We find our practices are vaccinating in three ways in the home. They're either, as a practice, taking it upon themselves to vaccinate, they're referring out to other organizations, or they're establishing a working partnership, something more formal and structured with a couple of outside organizations. Regardless of which option the practice is using, all require very much a partnership mentality due to the issues that Margie pointed out in her introduction. The theme here is opportunistic and creative. There is no one size fits all. It's a patchwork, and these practices are just trying to figure out what can work for them. And those practices that span counties, and many do, are having to come up with solutions that are county specific because of varying rules, regulations, and processes that the county, particularly the Department of Health, is putting in place. So our practices typically start by triaging the patients. Who can get out? Who's mobile? Well, they're all home limited. Some have the ability to be mobile, to be transported, and who cannot? Who's literally homebound and can't get out? They're also educating their patients, one, on the vaccine itself, trying to separate fact from fiction. There's a lot of noise out there. So a lot of our information that we provide our members is education on the vaccine itself and what the patient should know. And then they provide their patients with options, for accessing the vaccine. So I'm going to go through a couple different approaches and discuss each on how they're assisting their patients to get vaccinated. First, when the practice chooses to vaccinate with their own staff, their own personnel, that's a particular big challenge, and we find that more among health systems or larger practices, particularly that have backing of some sort, some capital backing. Because of the wide variability in regulations and access, it's a real challenge and it requires a lot of staff time to work that up. It's also expensive. You have to have all the storage, particularly with the Pfizer and Moderna. You have the storage and logistical issues and the transportation issues. And reimbursement is poor. I think it's $17 administration fee for the vaccine, which can get expensive for these practices to support that. So some are doing this, most are not. Most of the average practices we have as members are not approaching in this manner. Again, this is predominantly health systems and better resource larger organizations. Now, some practices are referring out to other organizations. For example, many pharmacies like CVS or Walgreens are going into the assisted living and vaccinating patients. So they're just referring the patient to family to the Walgreens, the CVS that's serving the particular assisted living that senior resides in. EMS and fire in communities are vaccinating those that live in homes, not assisted living, but homes. So they can refer them to that. The VA is vaccinating. So if you're eligible for that, many senior community centers have vaccination days, and though that would be for those that are mobile, they can get transportation out. And then in some instances, churches are doing it with a parish nurse, a church nurse. So referring out to others is an option for the patients. And then the third is kind of a hybrid partner approach where some of these practices are actually vaccinating, and then they're also collaborating with us to do the vaccination. So some practices are working with a pharmacy. They could pick up the vaccine there, and then they take it to the home and they vaccinate. There's a patchwork of regulations that challenges that approach. In some states, you have to be an employee of the pharmacy to do that. And obviously the physicians or the nurse practitioners or the nurses in the practice are not employees of the pharmacy. So that can work in some instances. In some instances, the practices are getting access to the vaccine and collaborating with a home health agency. Their nurses going out into the home and administering the vaccine. They're in some kind of structured way of logistically organizing that. Typically, the home health agency is keeping the $17 for their effort. Others are going to federally qualified health centers, which seem to have reasonable access to vaccines, and they're sourcing the vaccine there, and then they're administrating it through their own staff or through a relationship with home health. I mentioned community paramedicine. They're coordinating with them for the vaccination, those that they can't get to. So really the partnerships work around both access and administration and this hybrid approach of what they can do. And you can see that practices then are balancing multiple approaches to getting their patients vaccinated. Now, there are issues with this, among them is who has access to the vaccine. So you're kind of searching and hunting, being opportunistic, compliance with a myriad of local regulations. And if you're spanning a couple counties, you're dealing with a couple sets of regulations. Another issue we found is the unique nature of home care medicine and the practice. You understand the culture and the goals of the family and the patient. There's a very strong relationship there, and there's often some concern about another party coming into the home who they don't know, administering the vaccine to the senior. And so there has to be education and trust building if that is part of the approach the practice would use. As I think through these venues, that I think this is great, sharing a broad set of solutions nationally will allow practices nationally to identify a solution that might work for them, or may inform public officials or poly officials of solutions that they may want to try that's working in another jurisdiction. We found that contacting the Department of Health is likely the best bet for a practice to start, both with access and with the regulatory and compliance and rules that they need to follow. Our advisory committee, clinical advisory committee, feels that the J&J vaccine shows a lot of promise. Its logistics around storage and temperature and fragility compared to Pfizer and Moderna are much stronger, and it's a one dosage, so you're not coordinating access to and then follow up for a second dosage in a defined period of time. They feel that the J&J vaccine will be the predominant offering in the home environment. And finally, I'll just editorialize that the CDC didn't have any kind of compliance or regulation or suggestions on home vaccinations until February 19th, and it I think is symptomatic of a larger concern where we feel those that are home limited, those that can't access traditional clinical settings, aren't being thought of in parity with those that are more mobile. So both the providers, the workforce, and the patients that focus in this area aren't getting the first thought or the thought along with parity and with other clinical settings. So with that, that's my remarks that I've prepared, and I'll turn it back, I think, to Margie.
So before Margie picks up here, if you wouldn't mind, Brent, I'm gonna
sure.
take the privilege of just asking a quick question. And thank you so
Absolutely.
much for all you are doing and all that your membership are doing. And thank you too for plugging public health as a good place to start. We do agree with that. So there's been a lot of discussion about allocation of vaccines, and because, some of them are going to the pharmacies, a lot of them are going to public health, but they're also now going in, a number of different directions. And with the limited amount of vaccine supply available, it's a concern. So I'm wondering, for your folks who go out and actually are able to vaccinate, where are you getting your supplies?
The two predominant sources for the folks for health system based house call programs, and there's many of those. The health systems themselves are sourcing it.
Got it.
Okay. For independent practices, that would be the Department of Health or a pharmacy.
Mhm.
Is there? We have a couple of practices that I'm aware of that, and I'm not going to use the right language, but they applied to be and were accredited vaccination sites, and like one in Colorado, one in California, and that means they have the storage and the training to handle the vaccine, and they're receiving supplies directly. But that's by far and few. That's not much at all. So that's how our practices are accessing the vaccine.
Got it. Thank you. It's a complicated process.
Yes, it is. Yeah.
It really is. It really is. So with that, thank you so much, Brent. I share Megan's appreciation for all the amazing work that's going on. We want to open it up for all of our attendees to be part of the discussion, ask any questions you might have, starting with questions that you may have for Brent, but we won't be limited to that. Feel free to raise your hand in your gallery view or put a question into the chat so that we can invite you to join. And our first question is from Melissa Marks. Melissa, go ahead.
So Brent just mentioned something about one of whoever it was in Colorado that was approved to get some vaccines kind of outside of, I think, the public health department. I just kind of caught the tail end of what he was saying there. He had said there were, I think, 2 states that an entity had gotten some additional approvals. I was wondering who that was in Colorado.
Yeah, in Colorado, it's Bloom Healthcare, BLOOM. Thomas Lally is the physician and owner, and he applied early on. And it's funny to say he couldn't find a new refrigerator that could store Pfizer, so they found a used one on eBay and drove to Iowa and picked it up. So access to even the kind of hardware you need is key. And yeah, so he was able to get approval from the state of Colorado, and he's been doing that.
Thank you. And it's interesting now that you say that, I've seen emails with that name on there. And it's interesting to see how these decisions are made and why certain entities are showing up in our community in El Paso County, Park County, Teller County in Colorado. It seems that our health department is primarily the key source, and we haven't had a whole lot of home care folks sign on yet. People are interested in that. We are just now in the process of identifying the homebound senior population and coming up with strategies for how to get in touch with them. And we're getting that nailed down as we speak. We have just been, as I'm sure everyone else feels the same way, just going nonstop on this for sure. And our pharmacies, of course, are involved too, but our health department has just done a great job in our area too.
And I know several members are working with fire, EMS, and senior centers at the city level to understand, because they know who the frequent flyers are, the home limited, if the practice, if you're not working with a practice and specifically to help identify those that aren't getting out or those that are home limited.
We have a question from Maggie Orenstein, and I'll just read the question, and
Sure.
Maggie, feel free to jump in. Is the inclusion of family caregivers in receiving vaccinations at home anywhere in these discussions? And the brief answer is absolutely. It's coming up all the time. But feel free, Maggie, to tell us more about what's prompting the question.
Hi, can you hear me okay?
Yes.
Yes.
So I just, I've been advocating for family caregivers to receive priority for vaccination. It just seems to me that with, 80% or more of care happening at home, that if there's a homebound senior, that there's also a family member who needs the vaccination as much, if not more than the senior also. So just increasing the impact. And I wonder if anyone is actually doing this anywhere.
Yeah, I think, in talking to a few practices, I believe Mount Sinai in New York City might be vaccinating the caregivers as well as the senior. I'm not sure of other practices. It's an important, I think part of it is access to the vaccine, right, and limited supply. But I think the practices understand the importance of it and are trying to do it. But the only one I can say is, I believe Mount Sinai in New York City is.
Yes, and we have heard about this happening in some states where there's simply a policy that's been instigated that if you're in a home and you have an open vial and there's a caregiver there, to go ahead and vaccinate them, but it's definitely not a universal.
Right.
And do we have another question? If not, a question for Brent, feel free to join in and tell us about the partners that you're working with to provide vaccines to homebound folks, or who you wish you could work with. And I'll ask also when you jump in to please identify who you are and where you're coming from.
So I have another question while we're kind of waiting for other folks to jump in here. I don't want to monopolize, but I do want to keep the conversation going. Brent, one of the three ways that you say you partner is in the more formal partnerships that require potentially agreements. Could you describe that in a little bit more depth in terms of how difficult that is, who those partners are that you need to have formal arrangements with?
Yeah, the instances are typically like a home health agency, not so much with community paramedicine. It's more of a working agreement, or I shouldn't even use the word agreement, a working understanding of how things will be done operationally and scheduling. But with the home health agencies, the practices that I'm familiar with have had to get an actual agreement for the RN to actually, the home health agency to actually bill the $17. I'm not sure of too many of the specifics, but those are the instances where the practice is actually getting a legal agreement between the other entity.
Okay, thank you.
And we see a familiar name, Terry Fulmer. I'll let you introduce yourself, Terry, and ask your question.
There we go. Thank you. Wonderful, wonderful presentation. Thank you so much. And how can we help increase that $17? That we all know what it takes to get to a person's home, to get in there, to support them, to be, what do we do?
Yeah, thank you, Terry. I think that this here, increasing awareness, I think telling your representatives, your officials, how important this is. I think anytime you have the opportunity to advocate for caring for seniors, for a senior-friendly health system, and this is certainly part of that, I think that policymakers and your elected officials should know about these issues and the importance of serving these folks.
Great,
and
great. And I know CMS is very interested in this.
Yeah.
I talked to them yesterday.
Oh, great.
And, I know they're very much following this work, and we appreciate that. So thank you.
And the Academy does have a strong public policy and advocacy initiative. So we work closely in Washington to promote this and other aspects of caring for seniors in their home.
Great. Proud of what you do.
And for those of you who might not know, Terry Fulmer is from the John A. Hartford Foundation, one of the funders of this work. We have Mary Jo Plain has her hand up. Can you introduce yourself, Mary Jo?
I just want to thank you first for letting me be a part of this huddle. And I really appreciate your expertise. So I'm with the Reserve Family Foundation, and I'm in Oregon. We fund in Oregon, and we're seeing vaccine distribution be very difficult in our the rural parts of our state in particular. So we're thinking about and just in process right now of investing in an organization that has these medical clinic vans that can travel, and hopeful for that Johnson & Johnson
Yeah.
vaccine. They were just, it's Medical Teams International. They were just approved. They have a U.S. program, and they've been doing it in Washington, and they were just approved in Oregon. And then what we're going to do is partner with, we're hopeful for Oregon State University. It's a land trust university, so it has an office in every single county in Oregon. And then with local community CBOs that have relationships with seniors, either Meals on Wheels or Central Council on Aging, to take the vaccines into these nooks and crannies of Oregon for vaccine distribution, maybe leveraging, talking about, could Meals on Wheels folks bring them to the van, or does the van need to go out into the community? And even looking at like migrant communities and underserved communities in these rural pockets of our state. And I just wondered, Brett, does that sound like a good platform, or would you have any words of wisdom for us as our first clinic is supposed to be March 22nd is what we're shooting for. So I just wanted to know how you feel about that, or what you think of that. I'm just interested in anyone's expertise, because we're all figuring out why we're driving the truck down the road.
Yeah, we're building the plan as we're flying it. No, that sounds like an outstanding opportunity there to serve the nooks and crannies, and with the J&J vaccine, if that's what you're using, that'll even it's an advantage. So I think that's great, and it could be a model for other rural areas that are struggling with their population getting access to the vaccine. And it might not just be seniors; it could be those who are disabled, or even folks as the age cohorts are lowered, so that more and more folks are getting vaccinated. That can work for them too. So I think that's outstanding.
Thank you.
Riley has asked if we can distribute the slides, and the answer is yes, we can. We have your emails from your Zoom registrations, and we're happy to share.
And I'm happy to put people in touch with. I'm not a physician, so if you have questions that a physician expert might be more appropriate for, we have physician leaders that would be happy to talk to people, or talk to me if I can help.
We have just a couple moments left. Is there one or two more questions that we can take? Okay. Wendy Patterson, please introduce yourself and ask your question.
Oh, hi. So this isn't exactly a question. It's just we're in Alameda County, California. We're a coalition of CBOs that work with older adults, and we're working with our public health department here in the county. And they're doing pop-up vaccination sites in high-risk, high-impacted neighborhoods. And what we found, looking at sort of who's able to get there, we found that the sites that have both a drive-in capacity as well as a walk-in are the ones that work best for homebound older adults who are able to find, able to have either a CBO transport them, or a caregiver or a neighbor transport them, because they can stay in their car, and it's easier on them. And so that they're taking advantage of that as opposed to the walk-in.
And I think it's that kind of sharing of what's working is going to help us win this, because different things are going to work in different areas.
Anybody else before we turn to our last few comments?
Margie, this is Jane. If I'll just ask a quick question. Jane Carmen.
Of course.
Privileged to be with the Johnny Hartford Foundation and working in this work. Brent, one of the initial calls that we had on this was how important it will be to report who these people are and how we're doing. Has there anything that you're doing that is obviously we have to define people that need vaccinations in the home, and then to count them and to see how we're doing? Any progress that you're doing that can help the rest of us?
The Academy itself is not monitoring just anecdotally what the practices do, but I know the individual practices are. obviously logging all of this. But as an association, we're not. We're just monitoring what other folks are doing and staying abreast of ideas.
Wonderful. So we are just about out of time, and we're going to go to the last slide. I want to thank all of you for this rich conversation today. I can see it could have gone on for much longer. For the next several weeks, TIFA will continue to host these 30-minute huddle calls on Wednesdays and Fridays on topics related to enhancing access to the COVID-19 vaccine for the homebound population. Our next call is on Friday. Our next call is on Wednesday, the 10th of March on the we will look forward to having as many of you join us as you want, but please spread the word to colleagues as well. I'm going to paste the links for registering for these into the chat in the event that you all don't still have them. We want to make sure you do. And want to thank you all for the incredible work that you are all doing out there in this very challenging time. Thanks everyone for joining today.
Thank you very much.
Thank you.
Have a great day.
Thanks, everyone.
Thank you, everyone.